Miss Budiardo.
Hi.
My name is Izzy Landgrave. I'm going to be your physical therapist.
Okay.
How are you?
Good.
Okay. Is this seat comfortable for you?
Mm-hmm.
Okay. So, I understand that you're having some knee pain, and to get started, I would like to ask you some questions to learn more about your condition, and it will help me determine which exams to use later on.
Mm-hmm.
Is that okay?
Mm-hmm.
Okay. So, I see here that on April 1st of this year,
Mm-hmm.
you injured your knee after a long run.
Mm-hmm.
Can you tell me about how that happened?
Yeah, so I've been training for a marathon since about January, and so on April 1st was one of my longer runs, and it was a 14-mile run, and it was like kind of hilly, and after I did that run, my knee felt a little stiff afterwards, and then about 3 or 4 hours later after completing the run, my knee was really swollen and painful,
Okay.
and I couldn't really walk properly, and I had a limp, and then that took about 4 days to resolve itself for me to be able to walk normally.
Okay.
And then now I don't have a limp anymore, but it hurts. My knees hurt when I run.
Okay. Just to clarify, which knee is it?
It's mainly the left knee, but sometimes I do have pain in both. So I would say more severe in the left, but also some symptoms on the right.
And what are those symptoms that you're experiencing?
Mainly pain.
Pain.
Yeah.
Okay. And on a scale of 0 to 10, with 0 being no pain and 10 being the worst possible pain, how would you rate your pain right now?
Right now, my pain would be a 3 out of 10.
And when the incident occurred?
That would be a 7 out of 10.
Okay. Does your pain vary throughout the day from a 3 out of 10, or is it constant?
It does vary depending on what I'm doing. So, like going up and down stairs, it's more painful than walking or sitting.
Okay, so stairs aggravates the pain. Is there anything that relieves the pain?
Not using my knees.
Okay. Is there any other way that you're trying to get relief from the pain?
If my knees are swollen, I'll put ice on them, and that usually helps with reducing some of the swelling, and I have less pain when I ice it.
Okay. Okay. Could we talk about how often you are running in preparation for the marathon?
So before the injury, I was running 3 times a week for a total of 25 miles a week.
Okay.
It would usually be two shorter runs, around 6 miles, and then like a long one around 10 to 15 miles. And then now I only run one long run per week.
Okay.
So I guess like 8 to 10 miles.
So you've decreased the mileage. You also mentioned that you are having trouble with rock climbing. How has your activity level changed with your injury?
Currently it's the same amount of rock climbing that I'm doing.
Okay.
Yeah.
Okay. And is there anything else that you are having difficulty with other than stairs and running?
I think getting off of a chair, standing from a chair is more difficult.
Okay.
Squatting.
Okay. So I see that you are a student, and it says that you have to sit a lot, walk, and bike. Does sitting aggravate your pain?
No, it actually feels better because I'm not using it when I'm sitting.
Okay. How about bicycling?
Surprisingly, biking doesn't affect my knee very much.
Okay, that's good. So now I'm going to ask you some questions regarding your medical history.
Mm-hmm.
I see that you haven't had any illnesses within this past year. You did have a pap smear. Was that just routine?
Mm-hmm.
Okay. And regarding your medications, I see you're taking ibuprofen.
Mm-hmm.
What is that for?
That was mainly after that really long run where my knees really hurt in around April 1st.
Mm-hmm.
I took ibuprofen for pain relief.
How often were you taking that?
I was taking it about every 4 hours,
Okay,
about 2 tablets
2.
every 4 hours.
Was that the 200 milligram?
Mm-hmm.
Okay. And I also see here that you have a history of allergies. What are you allergic to?
Dust mites and cats and dogs.
Okay. Are you taking medication for that?
Yes, I'm taking Zyrtec.
And is that well controlled?
Mm-hmm.
Okay. Do you have any stairs at your house?
Mm-hmm. Yeah, there's 3 stairs to get to the entrance, and then it's flat.
Are you able to navigate those stairs
Mm-hmm.
with your condition? Okay. Mm-hmm. Okay. And what are your goals for physical therapy?
I would like to be able to run a marathon without pain.
Okay. Do you have a timeline for that goal?
No, just in the future.
Okay. So I've reviewed your form now, and I have a better idea of which exam to conduct. Do you have any questions that are related to your condition or to your health, or anything you feel I should know that we haven't discussed?
No.
Okay, great. Let's move on.
Okay.